the witch doctor had something, I don't know what it was, but a very impressive and significant respiratory irritant that he put in front of under my nose, and I took a deep breath, and that was his attempt to deal with Western medicine. The point being, you should be skeptical, and I should have been skeptical. And the priest who introduced me to the witch doctor was skeptical, and the Haitian nurse who was my assistant, she was skeptical. I remember the look on her face, and she was very skeptical, but I said, yeah, bring them on in. So there's really good reasons to be skeptical. So skepticism is not a bad word. There's good skepticism and there's bad skepticism. There are other reasons. I mean, that's a pretty extreme example. I think another good example that we all agree with, something y'all appreciate, is when someone from the government presents himself to you on the telephone or in the even in a mail, in a snail mail, or in person, says they're there to help you. You should be skeptical. But skepticism can also be bad, and skepticism that is not based on facts or reality or what's going on. Now, there are two, there are multiple, looking at my notes here, I've run across a lot of skepticism regarding this device. Very honest with you, even my own specialty is very skeptical. I applied 3 separate times to present to what my information is based on my 3,000 patients, of which that was very impressive. I had one, not to me, to others. I had one of my colleagues within the executive portion of the American Association of Oral Maxillofacial Surgeons. She said, "Oh my God, Tony, you got 3,000 patients that you treated with this device?" I said, "Yeah." But I have applied 3 times to present at the annual meeting my information, just the information about what I've used and what I discovered based on 3,000 patients to the American Association of Oral Maxillofacial Surgeons, which is a surgical group, but they need to know a non-surgical procedure that will be helpful to the patient, because even now they all agree if you're going to do surgery on the temporomandibular joint, you need to do quote conservative treatment before you'd ever consider doing any kind of surgical treatment.